Every time you go to the doctor, every single thing that happens in a hospital, even those public health announcements you hear, it's all being powered by this hidden world of numbers. Healthcare, it turns out, runs on a massive and pretty much invisible system of data. So today, we're going to pull back that curtain. We're going to explore how these numbers are gathered, what they're actually measuring, and most importantly, what stories are telling about our health, from a single hospital bed all the way up to the entire population. All right, to get us started, let me ask you a question. What could your body temperature and your gender possibly have in common? I know, sounds a little weird, right? But in the world of healthcare, they share something absolutely fundamental. They're both just little pieces of a giant data puzzle. And there's the answer. They're both data points. See, in healthcare, everything, from how old you are to the specific stage of an illness, gets translated into the language of data. And it's that translation that lets us measure things, compare them, and at the end of the day, improve the care that we all get.
Okay, but before we can analyze any of this stuff, we have to agree on the rules of the road. And that brings us to our first big topic. Why do we even count all these things in healthcare? Well, it all starts with creating a consistent language for measurement.
The key word here is consistent. For any of this to be useful, it has to be systematic. I mean, think about it. A fever in Miami has to be measured in the exact same way as a fever in Anchorage. If we didn't have that consistency, that reliability, we couldn't compare health outcomes from one room to the next, let alone from one side of the country to the other. So to speak this data language properly, we use 4 different scales, and each one gets a little more detailed. First, you've got nominal, which just sorts things into buckets, like gender or race. Then there's ordinal, which puts those buckets in a meaningful order, like the stages of an illness. Interval makes sure the steps between the numbers are equal, just think about degrees on a thermometer. And finally, ratio is the big one, the most powerful because it has a true 0. You can't, for example, have a negative length of a hospital stay. Getting these levels right is so important because it determines what kind of math we can actually do. And that leads us to another really key difference: discrete data versus continuous data. And honestly, it's pretty simple. Discrete data is stuff you can count, like the number of patients in a room. Continuous data is stuff you can measure, like your height or weight, things that can have fractions. Now, why does this matter? Because you can't calculate the average gender, right? But you can calculate the average height. That simple distinction is the bedrock for all meaningful health statistics. All right, so we've got the basic language down. Now let's actually put it to work. We're going to zoom in from all this theory and go right inside the walls of a hospital. It's time to, well, take the hospital's pulse, using what we call administrative stats. For any hospital, these administrative stats are literally its vital signs. These are the numbers that tell managers everything: how many patients are walking through the door, how many beds are free, and how they should plan for the future. They are absolutely essential for keeping an eye on patient volume and, of course, the revenue that keeps the lights on. Now, at the very heart of all this hospital data is one fundamental building block: the inpatient service day. The best way to think of it is as the basic currency of hospital care. It's just one patient getting services for one 24-hour period. Just about every other major operational number is built on top of this one simple count. So if you add up all of those individual days for every single patient over a whole month, you might get a number that looks something like this: 3,600 total inpatient service days. And that one number gives the hospital a really clear snapshot of its total activity for that month. So what do you do with that big number? Well, you can calculate something called the average daily census. All you do is take that total, that 3,600, and divide it by the number of days in the month. And voila, the result tells you, on any given day, about how many patients you can expect to be taking care of. It's a super important number for running the place. But it's not just about counting patients. Hospitals track other vitals too. The occupancy rate answers the question, are we getting full? The bed turnover rate reveals efficiency. Are we moving patients through the system smoothly? And the average length of stay helps them predict what kinds of resources they'll need. Altogether, these numbers paint a really detailed picture of a hospital's day-to-day story. But a hospital's data isn't just about efficiency and how many beds are full. Now we need to turn to the numbers that carry the most human weight, the statistics that measure the most critical outcomes of all: life and death. When a hospital looks at its mortality rate, there's a really important distinction to make.
The gross death rate includes every single patient who dies, period. But the net death rate is more specific. It leaves out patients who die within 48 hours of being admitted, and this gives a much more focused look at mortality for patients who've been stabilized and are under the hospital's ongoing care, arguably a better reflection of the quality of that care.
Statistics also have to account for the most tragic of outcomes. To better understand and hopefully prevent them, fetal deaths are carefully classified by gestational age. This lets health officials track patterns with a lot of precision and sensitivity, sorting them into early, intermediate, and late stages.
Another absolutely vital public health indicator is the maternal death rate. And the definition here is very, very specific. It's the death of a woman from any cause that's related to her pregnancy, but, and this is key, it excludes accidental or incidental causes. This precise definition makes sure we're tracking outcomes that are directly tied to maternal care.
So beyond mortality, we also have to track morbidity, which is just a term for sickness. And a huge measure here is the hospital-acquired infection rate. I mean, think about it. These are infections that patients get while they're in a hospital, supposed to be getting better. Tracking this number, sometimes called the nosocomial rate, is absolutely critical for improving safety and protecting patients from harm that could have been prevented. Okay, we've looked at the individual patient, we've looked at the hospital. Now it's time to pull the camera way, way back and look at the biggest picture of all. So for this final section, we're going to see how all these little individual data points are gathered up and combined to tell the story of an entire population's health. This is the world of vital statistics. And yeah, it sounds pretty official, because it is. This is the government system for collecting data on life's most significant events: births, deaths, marriages, you name it. This massive effort gives us that bird's eye view we need to really understand the health of the entire country. So where does all this big picture data come from? Well, it starts with documents you might not think much about, like a death certificate. It is so much more than just a record that someone has passed away. It captures who died, where they died, and, most crucially, the medical reason why. And that one piece of information, when you multiply it by millions, is what lets organizations like the CDC track what's happening on a national scale. Now, when it comes to tracking diseases, public health officials use two key tools: incidence and prevalence. The easiest way to think about it is like this. Incidence is like a video camera, capturing the flow of new cases as they happen. It measures your risk of getting sick. Prevalence, on the other hand, is like a photograph. It gives us a snapshot of the total number of people who have a disease right now. You absolutely need both the video and the snapshot to get the full story of an outbreak. And that really brings us to the whole point of all of this. We collect all this data on individuals, patients in hospitals, births in a city, so we can do something so much bigger. These numbers are used to infer the health of an entire population. They let us see the patterns, identify the risks, and put resources where they're needed most to protect all of us. So we end right where we began, with the stories told by numbers. From a single temperature reading to national death rates, this data is constantly writing the biography of our collective health. And that really only leaves one question. What story is our health data telling about us, and are we listening?